We hope you enjoy. So today we're going to go through the MACRA legislation overview. We're going to dive into some MIPS policy with a description and who's eligible. And then we're going to really focus on how MIPS is operationalized. An overview of how it's scored, the reporting options and submission criteria, and then some tools to help you succeed. MACRA is the Medicare Access and CHIP Reauthorization Act. It was established to rescind the sustainable growth rate formula and streamline our value-based programs. The chart you see in front of you has the percentage of national health expenditures, the change on the y-axis, and then years on the x-axis. I find this to be a really interesting depiction of our national health spending and the legislation that was put in place in order to try and control it. As you can see, we've gone through a lot of changes. PQRS was initiated in 2006, which really sort of started the value-based movement, with the ACA enacted in 2010, and then MACRA established in 2015. So what are the components that make up MACRA? MACRA is composed by MIPS and APMs. MIPS is the merit incentive payment system, and APMs is the alternative payment model. We're going to focus on MIPS, so I'll explain APMs first. APMs is a payment model in which providers assume responsibility for cost and quality performance of service. It really shifts accountability onto the providers. This means that there's greater inherent risk, but also greater inherent rewards. 5% lump sum bonus to providers after 2019. There are APM models that are eligible today. Those include the Comprehensive ESRD Care, two-sided risk, the Comprehensive Primary Care Plus, also known as CPC Plus, the Next Gen ACO model, Track 2 and Track 3 shared savings programs through MSSP, the Oncology Care model, Comprehensive Care for Joint Replacement. MIPS is what most providers will fall under. The MIPS is the merit incentive payment system. It's a streamline of a lot of value-based programs, including meaningful use, PQRS, and other VPM models. So in this program, the scores are based on quality, resource use, the use of EHR technology, and practice improvement activities. What's the goal of MACRA? The goal was really to shift operational focus from a fee-for-service to a value-based reimbursement model by placing greater accountability on providers. In fact, the Department of Health and Human Services has goals. By 2017, they wanted 30% of Medicare payments to be distributed through APMs and 85% of payments to be tied to value. And then by 2018, they wanted 50% of Medicare payments to be distributed through APMs and 90% to be tied to value. All the more reason that our organizations really need to focus on shifting our mindset from a traditional fee-for-service to a value-based reimbursement. So who does MACRA impact? In years 1 and 2, which is performance year 2017 and 2018, physicians, physician assistants, nurse practitioners, and clinical nurse specialists are absolutely required to report. In years 3 and on, many more providers are required. In addition to those, in years 1 and 2, we have now physical and occupational therapists, speech-language pathologists, audiologists, clinical social workers, and clinical psychologists. These is for all providers who take care of patients under Medicare Part B. So let's dig in a little bit more into MIPS. We know that it's a component of MACRA, and it is essentially a combination program taking PQRS, value-based payment models, and the Medicare EHR incentive program into one. MIPS then measures factors on quality, resourcefulness, clinical practice improvement, and advancing care information. What is the process for MIPS? It's 5 steps. Let's talk about operationalizing each step. The first step is reporting, determining whether you're going to report as an individual or a group. The second step is participation level, determining which level of performance you want to participate in, and then calculating your score in each of the qualities. Step 3 is weighing the score calculation, determining your overall scores weighted by how much each category is worth. Step 4 is comparing your score to your peers. And finally, step 5 is the payment adjustment. So in step 1, you're going to decide whether you're reporting as an individual or as a group. Individual physicians report data via a clinical qualified data registry, a qualified registry through their EHR, or through administrative claims. Group physicians can report in the same ways and also through the CMS web interface if it's a group of 25 or more physicians. CMS defines a group as a single TIN with 2 or more eligible physicians as identified by their NPI. Who is exempt from MIPS? There are providers who will not need to report under MIPS. Those providers are first-year Medicare providers, providers that bill less than $90,000 per year through Medicare, providers seeing less than 200 Medicare patients, and qualifying participants of APMs. If you are in one of the advanced payment model systems, you do not have to report under MIPS. Step 2 is determining your participation level and scoring. So will you participate fully, moderately, with passing participation, or will you not participate at all? Full participation requires that MIPS measures be reported for a 90-day period and quality measures be reported for up to a full year. Moderate participation means that you report more than one measure in quality and clinical improvement, or more than the 4 required measures of advancing care information for at least 90 days. Passing participation means that you report 1 measure in quality and clinical improvement, or report the 4 required measures of advancing care information. And then, of course, non-participation means that you fail to report any measures or activity in the MIPS performance categories. Hazard sign here, choosing not to report will absolutely result in a negative payment adjustment for your Medicare payments. How are these scores weighted and calculated? For 2017 performance year, the performance is weighted 60% on quality, 25% on advancing care information, and 15% on clinical practice improvement. So when you complete a measure in each of those categories, they are weighted accordingly. For 2018, the weighted performance shifts a little bit. Quality is now worth 50%, and that other 10% is going towards resource use, otherwise known as cost. Clinical practice improvement will still be worth 15%, and advancing care information, 25%. We can think about this in terms of the quality being similar to our PQRS reporting, our clinical practice improvement activities, and advancing care information being similar to meaningful use. Our resource use is calculated solely based on Medicare claims dollars, and there's nothing to report here. Medicare is going to take care of that calculation for you. Each performance measure category is worth a certain number of points based on its percentage weight. So this table has a lot of rich information in it. It will be available for you all to review after the webinar is concluded. It reiterates how many points are each category is worth based on the percentage weight. And remember, it changes. So for performance year 1, 2017, which we are in now, the weights are 60, 25, 15, and 0, and then that shifts for performance year 2 or 2018. The submission process for each performance category is fairly consistent with some changes. Quality can be submitted via claims, qualified clinical data registries, and qualified registries, as well as through your EHR. Groups can also use the CMS web interface and administrative claims. Cost, There's no submission required for cost. As I said before, Medicare goes ahead and takes care of that calculation for you. They take all of your claims and add your patient costs together. Advancing care information is done through attestation, also through qualified registries and your EHR. And finally, improvement activities are submitted in the same way. So how is your score compared? Providers are publicly scored on each of your quality, cost, and infrastructure measures. And then there are increasing levels of competition among peers based on your scores. So there will basically be a roundup of all the provider scores. They're going to graph it on a big bell curve. They're going to decide the threshold for high performers and low performers. And based on that threshold, they will assign a payment adjustment. What's important to note here is that this is not a program that has been given any money. That means that the high performers will simply be taking dollars from the low performers, or put another way, the low performers will be paying the high performers in the form of a negative payment adjustment. The high performers will earn a positive adjustment. So by the year 2020, every provider's MIPS score will translate into a payment adjustment, ranging from plus 4% to plus 9%. So let's break that down a little bit more. The performance year determines your payment adjustment 2 years later. So your 2017 performance will result in a payment adjustment in 2019. 2018 performance will result in a payment adjustment in 2020, and so forth and so on. The first year, it's either a maximum of 4% and a minimum of 4% earned or lost. By 2020, it goes up to 5%, 2021, 7%, and then in 2022, up to 9% gain or 9% loss. This is a range, so just because you report in 2017 performance year does not necessarily mean that you will earn 4% increase in 2019. It simply means that you're eligible for up to 4%. So has this been too much info? You're certainly not alone. A recent survey conducted by KPMG and the American Medical Association found that providers with previous experience with other programs tend to feel more prepared. However, overall, 51% feel like they're only somewhat knowledgeable on MIPS requirements. Respondents indicated that they need help in a lot of these areas. How do they what time is required to actually accurately capture and report data? How do they understand reporting requirements? They don't understand the scoring process or what organizational infrastructure is needed to report performance. These are very complicated things, especially if providers are doing this for the very first time. So don't panic. We're here to help. We have wonderful tools that support MIPS reporting through a qualified registry, provides both a qualified registry and attestation. Beacon reports can accumulate information from your EMR and across multiple practice management systems in order to do comprehensive, real-time, interactive data reporting, and then also take care of your submission requirements for CMS. So let's see how well we were paying attention. We have a little poll to share with you all. So I'm going to launch the first polling question. Go ahead and click your response. You're a physician that utilizes third-party data collection company to manage all of your patient records and other types of quality reporting. According to CMS, could you use this company for your MIPS reporting? If so, what type of data submission would this be? So I'll give everybody a few moments. All right, we're getting lots of different responses here. All right, I'm going to close the poll in 5 seconds. All right, so here's the results. The majority of you said a CMS approved QCDR. That is the correct answer. So the correct answer is an approved QCDR. A lot of times these qualified clinical data registries can report on other types of quality measures, not just MIPS required measures. That is a good thing. That means that your system is working to give you data on multiple programs. If you're involved in value-based contracts with other payers, that's very important for you to be tracking this information across your system on a regular basis. All right, are we ready for the next question? Gonna do 2 more. Here's your next question. For what purpose was MACRA established? All right, we'll give 5 more seconds. All right, looks great. Everybody got it right. To rescind the sustainable growth rate formula and streamline value-based programs in order to reduce national healthcare spending. Absolutely. MACRA's goal is to reduce spending. Great. And last one. What are the measures by which your MIPS score will be calculated in 2018? A little bit of a trick question here. Pay attention to the year. Oh. All right, I'm going to close the poll. We've got about a 50-50 split. So let's see what the answer is. The answer is A. In 2018, we are including resource use in our measures calculation. So for performance year 2017, choice B would have been the correct answer. But for 2018, we are including resource use or cost. So thank you all so much for listening today. Thank you for being with us. We are looking forward to launching 3 more webinars as part of this series. Stay tuned for more information. If you have any questions, I'll stay on for a few minutes to answer them. I don't see anything that's come through the chat box just yet, but I'll hang out for a few more minutes and answer any questions you may have. Thanks again.